Welcome back. An alleged thief was shot by police on Saturday in what was a foiled robbery attempt. 58-year-old businessman Benjamin Martelli came home to find his house being ransacked by unknown individuals. He was physically assaulted and sustained multiple injuries to his head. Both police and fire service responded to the incident. Martelli was taken to St. Jude Hospital for treatment. Fire spokesperson Stacey Joseph has the details of the emergency response.
Officers at the Micoud Fire Station responded to an emergency call regarding a shooting on Sunday 22nd November in Maguetut, Micoud. The emergency crew found on scene a male individual sitting on the road in the presence of police officers. He was carried to the ambulance where an assessment was done. The patient sustained one penetrating wound on his back. He was then transported via ambulance in a stable condition to the St. Jude Hospital.
As it relates to the police response, one of the alleged assailants was shot after the vehicle with several occupants suspected to be involved in the incident refused to stop. During the attempt to apprehend the individuals, a round of ammunition was discharged by officers, injuring the male driver. He is admitted at the St. Jude Hospital. Police say one woman and 2 men are also in police custody in relation to this incident. Police are investigating a case of suspected suicide. 52-year-old Norbert Shabatis was discovered hanging from a tree in Victoria, Choiseul on Friday afternoon. A farmer in the community made the shocking discovery around 2 p.m. Meanwhile, psychiatrist Dr. Julius Gillard says during this time of uncertainty, the media has a big part to play in the possible prevention of suicides. He says too often mental health issues are sensationalized rather than having solutions presented. Genevieve Gonzague tells us more.
Following word of yet another suspected suicide, local psychiatrist Dr. Julius Gilliard has called for less sensationalizing of issues that stem from mental health illness.
When persons report on suicide, they're supposed to bring a sense or try to bring a sense of hope to other persons who may be having difficulties managing certain situations or emotions. So when you report or you sensationalize a suicide like it's being done a lot, then persons may be more, and that has been studied, persons may be more prone to attempt because of what they see on TV or in other parts of the media. So the media needs to be very careful on how they report, and not just the media, but even the police or whoever it is who are having the media briefings with the police. They need to be careful on on the things that they say when they're reporting on a suicide.
He also explained that St. Lucian laws need complete revamping. He says the punishing of people who attempt to take their lives is archaic.
Charging somebody for attempting suicide is arcane. So that is no longer done anywhere else in the world because somebody is going through difficulties with their emotions or difficulty with other aspects of their life, and you're going to charge them for that. You understand? So this is a lot of countries are removing that aspect from the legislature, and I think it is time that we do the same. You cannot charge persons for attempting suicide. You need to offer them the assistance that they need.
Gilliard says more needs to be done on the parts of both the legal and health systems.
The laws of St. Lucia need to change. There is no Mental Health Act in St. Lucia in 2020. So there's a Mental Hospitals Act, but no Mental Health Act. And the Mental Hospital Act, I think it's from the 50s or something like that, if I can remember. And in 2020, the investment needs to be done, because that's not being done. We're investing in all kinds of other stuff, and the mental health of the populace is suffering.
Members of the public are reminded that the 203 hotline remains operational for anyone battling depression or suicidal thoughts. Reporting for Hot 7 News, I am Genevieve Gonzague.
As St. Lucia continues to see an increase in the number of cases of COVID-19, the Ministry of Health is imploring residents to practice infection prevention and control guidelines. Between Saturday the 21st and Sunday the 22nd of November, the island recorded 17 cases of COVID-19. Nisha Charles reports.
Of the 17 cases recorded over the weekend, the ages range from 6 years to 85 years old. The new positive cases were recorded in Castries, Grosley, Canaries, and Babonneau. Chief Medical Officer Dr. Sharon Belma George says that all of the active cases are stable and doing well.
Cases number 205, 208, 214, 216, and 217 are all from the Babonneau district. Cases number 207 and 220 are from the Grosley district. Cases number 206, 209, 211, 212, 213, 215, 218, and 219 are from the Castries district. Case number 210 is from the Canaries district. All of these individuals, after being assessed and tested, were placed in quarantine by health practitioners while awaiting their test results.
12 of these cases were identified through the contact tracing process, and epidemiological links have been established for these 12 cases.
Cases number 205, number 215, and 218 are linked to case number 196. Case number 206 is linked to case number 182. Case number 207 is linked to case number 194. Cases number 208, number 214, and number 219 are linked to case number 179. Case number 210 is linked to case number 176. Cases number 211 and 212 are linked to case number 193. Case number 220 is linked to case number 200. As per protocol, arrangements have been made to place the confirmed cases into care.
Residents are advised to practice the infection prevention and control guidelines of hand hygiene, use of a face mask in public places, covering both the mouth and nose, and maintain a separation of 6 feet when in public. If experiencing flu-like symptoms, keep away from others and seek medical care immediately at the closest community respiratory clinic. For the Hot 7 News, Nisha Charles reporting.
Thank you, Nisha. A former chief medical officer and the president of the St. Lucia Medical and Dental Association are weighing in on whether the island should go the same route as neighboring island Barbados and test visitors for a second time after arriving on island to ensure that they are truly COVID-free. Dr. Stephen King says it is an avenue that should be explored, whilst Dr. Merle Clark says the idea is on the table. Rochelle Gonzalez tells us more.
The government of St. Lucia has been under pressure for the past month to toughen measures and protocols currently in place to facilitate tourists on island. One such area being highlighted is the apparent need for a second PCR test to be conducted on visitors, whether they are from high-risk or low-risk countries. This call came after Barbadian Prime Minister Mia Mottley announced at the beginning of November that this measure would be implemented in her country to strengthen the fight against the second wave of COVID-19. Since this announcement, different sectors have called for the government to follow in Barbados' footsteps, including the opposition St. Lucia Labour Party. Joining in the call for such action was former Chief Medical Officer Dr. Stephen King.
We need to come together and brainstorm and look at best practices. Remember, in my particular presentation, I talk about the public health approach to how we need to move forward with our initiatives in this country with regards to COVID-19 specifically. And the Barbados Protocol is one that the business community is looking at very, shall I say, with great anticipation that it is a protocol that we may want to adopt or enhance. But what we're going to have to do is see how we can, because the protocol demands certain capacity and certain resources. So we're going to brainstorm on that. We're going to be sharing with Chief Medical Officer, sharing with the Government Command Center, how we think things could be done possibly. We'll work with them.
Dr. King said the matter calls for a collaborative effort to be made across the board. Meanwhile, the president of the St. Lucia Medical and Dental Association, Dr. Merle Clark, said the idea is very much a possibility. However, a holistic approach is being taken on the matter.
Whether we go that route or not, and we very well may, that we still think the other protocols in place have to be adhered to. It cannot be simply about testing. So if you test somebody while they wait for the results, or if you test and, for example, that when they tested, it might be negative initially, and we know that that has been known to happen, that there is no foolproof method in this fight against COVID-19, and there's so much we still don't know about COVID, that adherence to the other protocols, and for staff as well.
Dr. Clark stressed the point that on the part of the SLMDA, they are working with the well-being of St. Lucians as their top priority. Reporting for Hot 7 News, I am Rochelle Gonzalez.
And the St. Lucia Medical and Dental Association says it has not called for a shutdown of the country, even amidst the rise in COVID-19 cases. Nisha Charles reports.
According to the president of the St. Lucia Medical and Dental Association, Dr. Merle Clark, the organization's position to refrain from recommending a shutdown currently is partly due to the importance of tourism and for the furtherance of economic activity. She says there is a vast difference between the position taken by the association and by extension the government in March, as opposed to the country's current ability to better handle the COVID-19 pandemic.
The shutdown allowed, not only for St. Lucia, but countries around the world to stock up on PPE, to get testing supplies, to get better training, to get so many things in place that we perhaps would not have had before this pandemic started. And in every crisis, there is opportunity, and there has been opportunity in this, in that our testing capacity, not just for COVID, but for other infectious diseases, has improved. So we always have to see the opportunity in things. So that is what the shutdown allowed for, and we have been able to do that.
The SLMDA president says the shutdown not only allowed for the better management of COVID-19, but the quality of healthcare afforded to residents on a whole.
The refurbishment of the respiratory hospital, our members on the ground, we the ones who work there, in part, we understand the changes that have happened there and the improvements. I'm a nephrologist, so just from the perspective of dialysis, there have been significant improvements. We've been able to have more acute dialysis, what we call the water purification plants for dialysis. There is more of that, so that has made our lives a lot easier in terms of being able to manage the two hospitals, that we're able to do that a lot more effectively. So are there glitches? Absolutely, but we understand the changes that have been made to accommodate the patients and to try to get them in the best of care before they go home.
The membership of the SLMDA met with the Ministry of Health and Wellness last week to discuss all things COVID-19. For the Hot 7 News, Nisha Charles reporting.
You're watching the Hot 7 TV Nightly News. Still to come, driving instructors say 1 week after suspension of driving exams, there is still no word from the Transport Ministry on recommencement. Philip J. Pierre says completing universal healthcare will be a top priority of an SLP government. And the National Security Minister says, don't be a mark this Christmas season. That and more after the break.